were an amended copy of the minutes that were just circulated.
Oh.
And Luke, you wanted to speak to what the change?
Yeah, we just clarified Joan's comments to include that she was asking for objective evidence for the relationships and her objections to the motion to change that language. So we had a little bit more clarity there.
And so is that on page 1 or?
It's like the rest of it.
Yeah, it's the third paragraph up from the bottom. About the functionality of the system as we head through the fall. So we are encouraging everybody to sign up for the Get Notified list online so they know when updates are coming regarding the system. We're also planning hopefully 2 big demos in December. One focused for third-party administrator functionality and one focused on employer functionality. So we hope to demo the system, walk people through what it looks like in December before it actually goes live. In early 2025, we are working pretty closely with the National Payroll Consortium and PRC. They had some preliminary meetings with us and Fast Enterprises, and they'll be involved in the user testing as well down the road. The system's functional for them. That'll hopefully help, most employers in the state. So again, that's a big update for us. And then
Luke, can I just clarify? Yeah. So that portal is for contributions. Is that correct?
Correct.
Or will it also be the portal that will be used to request the benefits?
No, so it won't be tied to benefits most likely, but it will be for collecting contributions, wage reporting. It will be the mechanism through which self-elected people can opt in for coverage. So if somebody's self-employed and wants to opt in for coverage, they'll do so through the portal. It's also going to be the mechanism through which people can apply for a private plan substitution. And it has to be done online, so we have record of the company, can track their substitution information. And also, even if somebody has an approved substitution for a private plan, we do need them to still file wage reports through the portal so that we can capture the wage data for their employees as they move around. Because that will create the wage base, for the full year. So we need to collect that information still through the portal. Yes,
Did you say it's online only?
online only, yep.
And that accounts for all employers in the state being able to access that?
That's a hope. It's gonna be mobile friendly, online only.
But what about those who don't have access to dependable broadband, which represents 13% of the state?
Yeah, I think we're gonna have, like, if there's extenuating circumstances, we can look at paper processes, which is kind of similar to what the MRS does with the Maine tax portal. But we are hoping to get most people on the online portal.
Right, but what about the people that are not generally accustomed to using online portals or being involved in pay or payroll programs? So like seasonal, heritage, and agricultural groups, small employers that will be subject to this that may not have access or expertise?
Yep, no, we're gonna have hopefully augmented customer support starting in January. We are looking at getting a temporary call center to help, walk people through registration and the system functionality. It is pretty intuitive, the portal itself. Wage reporting only asking for very few things. It's pretty straightforward. But that being said, if somebody does need to rely on a paper process, we are looking, if they call us and let us know, we are looking at paper processes for people that can't have access to register online. But we are trying to get as much people online to the system as possible, just for functionality, administration, reduce errors, staffing, cost of administration of this program.
I understand that. It's just that the people that are in need of this programming, the employers, are really at the mercy of the ability of the employers. The employees are at the mercy of the employers being able to access that.
Yes,
So
I agree.
we have to also understand that there's a great number of employers out there who don't have this experience or, lived or otherwise. So.
And that's why we're looking at the augmented customer support. Like we did pull the trigger on that pretty recently, that we realized we're probably going to need to provide some, help to help people register and talk them through it. So we are looking to release an RFP for that procurement within a week or two, to make sure that there's plenty of people to answer the phone if people need to call come January, to walk through registration.
Okay, I just wanted to voice that because while the number of employers being underserved or not represented in this access is probably smaller than the number of employees. So a segment of the population that we are most wanting to make sure we reach and serve. Thank you.
Fair. Yes.
So the premiums are start to be collected 1st of January.
Withheld, yeah.
So will the system be functional by then?
Yeah, we hope so, as long as it's not project delays. But the wage reporting doesn't actually start until April 1st, but withholding can start in January.
Right.
But yeah, we're on track.
You're making contingency plans in case it isn't.
Yes.
Okay, who's maintaining the current website, the informational website?
The DOL website,
Yeah,
we are.
okay, so it's out of date, right? The information that I looked at even just this morning was, it talked about public comments due in June, I think it was.
No.
It said that, and then it said also, then it kept the historical, and then later said the new dates of
Oh,
September,
it did?
and there was a link to the rules.
Okay, oh, great, I saw
Yeah.
the link, but I didn't see the updated words that said.
Yeah, they
most
were in
current
there,
stuff
but they were
is June.
both in there, so I can understand it could be confusing.
Okay, all right, good, great.
Well, if you could just point it out after the meeting, we can make sure it's clear.
Sure.
We can talk about that offline if you
Okay.
show me, yeah.
Yeah, I just want to make sure. I get the right.
Yeah, we definitely want to make sure that's clear.
Yeah.
Thank you. for
I
pointing that out.
did find it a little confusing as
Okay.
well.
I'm sorry, can you remind me of the date of the hearing? Is it
That's
October 7th?
No, it's September 17th.
September 7th.
Yeah, at
And
9 a.m.
this one be recorded?
This one's gonna be live streamed if you want to listen, and it will be a recorded.
It will be live streamed this time.
Yeah.
Okay.
So, withholding starts January 1, reporting doesn't start till April 1. The intent would be that payroll providers are like, as an employer, do I have to, I can't remember, do I have to pay by the end of the next month or something after the withholding?
So you pay quarterly, you remit quarterly.
Okay, so do I keep that money in the meantime, or is my payroll vendor holding the money, do
Depends
you
how
know?
it's structured.
Okay, it could be either way,
I think so.
okay.
So it's gonna be released early 2025, and contributions are due starting January 1, 2025.
Well, withholding start. The wage reporting and the premium.
And the
remittances,
contributions not till April.
correct.
I see, okay.
The statute says wage reports and contributions are paid quarterly.
Okay.
Do the statutes or the rules talk about how the employee, if the employer is withholding from the employee, how those funds are to be held, similar to MRS rules around income tax withholding?
There wasn't anything in statute, I don't believe.
I don't recall anything in the statute.
Any other updates?
But do you want to give communications update?
Yeah, so we are launching a public education campaign for this program. And this public education campaign is going to be centered around just making sure like folks know, hey, come January 1, 2025, premium is going to be deducted so that when employees, they'll see their pay stub early next year and go, what is this for? Hopefully we'll have done enough of a good job to like let the public know that this is coming. But we're working with the vendor right now, Ethos, to do radio ads, TV ads, and all of that to let folks know that this program is coming. So, and we're also going to lay out, potentially, what the reasons you can take leave for. And so we're working with them to try to get the messaging tight and so that the public, has a baseline understanding, especially before January 1 comes around.
Will there be multiple languages? I appreciate the FAQs having multiple languages, but will that sort of targeted marketing include multiple languages, or will there be content that we can share?
Yeah, that's something we're definitely trying to keep in mind, like trying to make sure it's not just in one standard language, but we're, whether it's explainer videos or anything like that, we're trying to keep in mind the multi-language factor.
Any further updates?
Those are our big ones, yeah.
Big ones, yeah? A lot going on, thank you. Okay, so now we will have the time to discuss the newly proposed rules, and I just wanted to leave it open-ended since they just dropped on August 28th, and I didn't have a chance to review them before I prepared the agenda. I now have a chance to review them. And not knowing what folks would want to focus on, thought we would leave it open-ended for discussion, so I'll open it up.
Could I start? I was reading the approval of substitution plans section. And I was a little confused by it, and I thought maybe it would just be easier just to be like, can you give me a summary of what it says? In terms of so it looks like it changed so that you can apply earlier on April 1, 2025.
Yep.
And that'd be the employer applying, or is that or that's the actual, like, say, Unum or somebody applying?
No, that would be the employer, the
Okay.
Unum, working with BOI to get certification, and not to get certification would be before that.
Would that be before that? Okay. And then if I like signed up, I'm just gonna use Unum as an example.
Yep.
If I signed up for Unum, then I could apply starting April 1.
Correct.
Before April 1, I would have been withholding contributions.
Yep.
Then as soon as my, let's say it gets approved.
Yep.
Then do I stop withholding contributions then?
So the way it's worded, if you remember in the old section of the rules, the exemption from premium started the quarter after the substitution was approved. And so we moved up the start date, a year basically, but we also started the exemption earlier. And it's not necessarily the day the substitution is approved. It exempts the quarter in which it's approved. If it's not, and this is where it gets confusing, but this is, for reasons. If it's approved in a quarter, it wipes out your liability in that quarter. So let's say you apply April 1st, it's approved April 30th. You don't owe premiums for that 30 days from April 1st to April 30th because it wipes out your liability in that quarter retroactively. Unless it's in the last 30 days a quarter, then it's the quarter after it was submitted, because the expectation is it's maybe unlikely that we can approve these in 30 days. We don't want to create that expectation. So if you applied in June 29th, and it was approved in July 15th, your exemption from premiums would start July 1st.
Okay.
Does that make sense?
Yep. But there's no caveat that you have to start benefits before.
There was not a caveat that we immediately start benefits, and there was, concerns expressed about, can it even be required to start PFML benefits early? There was some,
Legal.
there's some pushback or some feedback about, can you require this? So we left it open-ended to the employer that as long as benefits start by May 1st, 2026, when the state plan goes live,
Okay.
The substitution will keep going.
And withholdings are not required as soon as whatever that date is that gets approved and you have the 30 days passed or whatever it is.
Whatever that system, just said is. But so that first quarter you would still be liable for, and you would still have to remit. Yeah.
But not passed.
Not passed based on the logic of that.
Yeah.
Very confusing logic I just said.
Whatever that date is.
Yes.
Not after that.
Yes.
Okay, thank you for that. That helps me. I read it a few times and I was just a little confused.
So last clarification of dates. First premium is going to be due April 1st, 2025.
For the first quarter,
For that first quarter, and you can't apply for a substitution until after April 1st. So
Correct.
all employers will start remitting premiums in that quarter, and if they get a substitution approved in April, May, they would get retroactive refund of those premiums back to April 1st.
They wouldn't have paid the quarter two to us yet.
But they would have paid April.
Quarter one.
They would have paid quarter one.
Yes.
So
Everybody.
everybody's gonna pay quarter one no matter what, and there's no retroactive.
What if there's a lag in approval? I mean, if there's like a flood of applications and some people are apply before the last 30 days of the second quarter, but
Well, that's why it did say
Approval
the
doesn't-
quarter when it's approved, so we're still not gonna be in a scenario where we have refunds due. So we're hoping not to get in that situation. We're gonna try to, put appropriate resources on the quarter two application. The exemption for premiums start in the quarter in which the substitution is approved. So if there's a lag of 4 months, you would be owing the second quarter at that point.
you would be owing and there won't be any refunds or
That's the way
okay.
it's written currently.
But if I read that correctly, the first quarter, the employer still has to refund the employee contributions if they
If
took
they were
it for that
withholding,
first
yeah.
quarter.
Yep.
So they're in the whole 1% for the first quarter. The employer is,
Well, no, they can withhold from their employees for the first quarter.
right, but they have to refund it if they go private. At least that's how I read it.
So maybe if we can just
Maybe clarify. that.
start from January 1st.
Yeah.
January 1st through March 31st of 2025. All employers have to remit the 1% and they may withhold up to half of that from workers. Starting April 1st, employers can apply, but they still have to remit January through March premiums. And they can, so let's just say an employer applies sometime in between April 1st and May 31st. Before June 30th. They will not have to remit premiums for April, May, and June.
And they won't have to remit premiums back for the first quarter.
Yes, everyone will have to remit
Well, they won't have to pay back employees.
for January, February, and March.
Mhm.
Everyone will have to remit to the state.
Understood, but if you go
Employer,
private,
employee.
if you go private, you don't have to pay the employees back for the amount that you withheld in the first quarter.
Correct.
Then that's
Okay,
confusing,
gotcha.
because
Yeah.
it's written, I don't know how you guys read it, but it has wording in there that says employers have to remit back to the employees.
Oh, that was, yeah,
If an employer, I think what it says, and correct me if I'm wrong, Luke, if in that April, May, and June period, if the employer still withholds, and then they retroactively get the exemption, then they would have to reimburse the workers for April, May, and June, whatever they withheld.
Okay,
retroactive to
So
the
maybe
exemption approval
we can
date. The
clarify.
exemption approval date can't be prior to April 1st.
Yeah,
So the
Right.
January, February, March contributions are, they're made.
no, I get that, and I'm not arguing with anything, I just found that unclear, because it had talked about employers being on the hook to respond, to remit back to employees their 0.5% if they had taken it from January through March. But if I misread that, fine,
date for the exam.
you know. make
Yeah,
it
we could
clear
probably
to
provide
everybody.
more clarity in
Yeah.
FAQs, yeah,
And scenarios.
scenarios, yeah.
Mhm. Thank you.
And once you do go private, you can't withhold half, you can't withhold the employee part.
Once you go private, you can't charge more to the employees for your private plan than the state plan would cost. Because you're gonna be paying premiums to a private company at that point, and you can't charge the employees more than what they would be remitted, or more than what they would have withheld for a state plan.
So you can withhold half a point from employees following, beginning April 1st.
Well,
Assuming you get
if you're paying premiums too.
Yeah.
Because I mean, some people may choose not to start benefits until May 1st, and at that point, they're not paying premiums either.
First,
Okay.
2026.
Right. But but during that time, you can withhold from the employee or you cannot.
If you have costs, if you have premiums to pay, you can withhold.
So, and were there any numbers that were crunched just around, because I know we talked about the funding the plan, and initially the Department of Labor was thinking that it needed more funds to seed to the plan prior to allowing private substitution. So can you explain to?
Well, I mean, there's
Why
gonna
the
be, there's gonna be lost revenue, but any private plan substitution is also gonna have lost benefits we need to pay as well. So we're hoping that's a cost or, net zero, that any lost revenue is equally outweighed by the lost benefit payments. So we're hoping that plays out in reality, that, if 30% opt out and there's a 30% loss in revenue, there's also a 30% fewer amount of premiums, or benefits paid out. So we're hoping net zero, but I mean, that's something we're gonna have to study through the actuarial studies, next year, but probably the years after as benefits actually start. But revenue wise, it's gonna be somewhere between 10 and 30% based on what we see in other states. But Maine is, untested still. We don't know what our opt-out rate will end up being in reality. But the hope is that the benefits will also be decreased by 10 to 30% as well.
But you do have fixed overhead,
For the program administration, yes.
so.
If the plan is self-insured.
Yeah.
How are the premiums calculated? Would the employer still be allowed to withhold from an employee contributions to the self-insured plan?
If benefits are live, I would imagine, yeah.
And there's gonna be some mechanism for how that premium base is being calculated? As we just talked about, they have to have cost, and it can't exceed
One
half
time,
a
yeah.
percent of your wages, right?
And the bond, I'm sorry, I think you had your hand up there.
I just had a related, well, you should probably go ahead, because mine's been taking a slightly different direction.
Okay, mine is also.
So, all right. So I was noticing the very intense appeals process. So what I'm unclear on is if a company goes private, do they have to replicate that appeals process? Or what are the employers obligated to do, whether it be self-insured or insured privately?
So they're required in the private plans to have the initial claim and also a reconsideration claim with the private plan. Similar to the state plan, we're gonna have an initial claim and then an immediate reconsideration if you appeal like one level. And then the second appeal has to go to the state regardless if it's a state plan or a private plan.
Oh, it does?
Yeah,
Okay.
because it's subject to APA, Administrative Procedure Act.
Okay,
So we could have private plan, we'll have private plan appeals on the second appeal, so past reconsideration, if there's a denial, appeals at that level would go to the state for a hearing under the APA.
thank you.
Just a quick follow-up. If the state approves a private plan, it is the job of the state to make sure that the private plan is operating accordingly. It's not the responsibility of the employer who's paying for that plan, correct?
Well, I would say both, but yeah, but we're gonna have oversight and audit. And if it's not maintaining substantial equivalence, in practice, is I think how we word it, the private can be revocated. And then the employer is required to be in the state plan for at least 3 years.
Right.
Yep.
Question or comment?
I did not.
No. Is there a bond for the self-insured? Is there a bond amount that has been set?
So we're gonna
or formula?
provide FAQs, hopefully on that within a month or two, but right now we're looking at, well, I think we should probably wait for the FAQs. There will be a bond, yes. Let's wait till we actually put out the FAQs. But that'll be clarified in the FAQ, how much is the bond amount. And, you know, once rules are finalized, I think we'll actually put out the self-insured application. Because fully insured is gonna be relatively straightforward. You know, people will get certified with BOI and us, and then they'll just apply with those plans to us. Self-insured will be kind of a separate application. And we'll put that out once rules are finalized. It'll be similar to applications you see in Massachusetts and Connecticut. We're looking to them to kind of benchmark what they did.
Why?
There you were.
I was just curious why there was an additional line added in this potentially equivalent plan to be minimum 10 weeks versus the 12 weeks for everybody else.
Yeah, it's a good question. So we had a lot of comments about putting some guardrails on private plans to make sure time was also considered. And people specifically in the comments we were getting were asking us to put in a guardrail of 12 weeks. Can you put in a guardrail of 12 weeks for substantial equivalent? And the short answer to that is no. We can't say 12 weeks is substantially equivalent because there is a line in statute, and I actually have it up here. It's statute H. H1. Yes, thank you. H1D.
H1D as in boy or D as in dog?
D as in dog.
Thank you.
That's not the one. Yeah, that's it. Benefit amount. Oh no, it is D as in boy. H1B as in boy, providing a family leave benefits and medical leave benefits to a covered individual for a maximum number of weeks substantially equivalent to the maximum number of weeks required by section 850D, which is 12. So that phrase substantially equivalent to does not mean greater than or equal to. So we had this discussion. Since it says substantially equivalent to the maximum number of weeks, we can't say 12. That's not substantial equivalent because that would be greater than or equal to. But we did agree with the comments that there should be some guardrails because the way it was structured previously, you could have somebody pay, 200% wage replacement for 6 weeks and potentially have a substantially equivalent plan. So we agreed there needed to be some guardrails. Recognize there was statutory limitations to say we can't say 12 weeks is, the minimum because the phrase substantially equivalent is used in that line. So we came up with 10 to benchmark to the unpaid Maine medical leave, just to have consistency there. But that was in response to a lot of comments about asking to put minimum guardrails on substantial equivalence. So 10 weeks is allowable as long as the maximum benefit or the benefit payment amount is greater than or equal to. So if there was a 10-week plan, it would have to give wage replacement that is more than what they would get, greater than or equal to more than what they would get with the 12-week plan if they were to take a max benefit, if that makes sense.
So even if the duration's shorter, the benefit.
The total benefit has to be greater than,
Okay.
equal or greater than.
I'm just curious, why would somebody do that? Why would somebody alter the weights and increase the pay if it's the same?
Get them back sooner.
Yeah,
Get them back to work
Get
sooner.
it back sooner.
so instead of 98% at 12, it could be
It has to be
100% at
at least 100,
10.
I would
Yeah,
think.
or 100, whatever it is.
Because it would have to be at all income levels, both your low wage earners and your high wage earners.
And so, but from the 10 weeks was, do you think that it could be any amount less? It could be 11 weeks? To satisfy the statute, it just can't be the 12 weeks because otherwise.
We can't say greater than.
Greater
Yeah,
than
can't equal
to,
there, greater than,
because of that language used in other parts of the statute. You know, 11 and a half weeks. 11 weeks and 3/4.
I don't think so.
Our law in Maine is unique. We are the only state that has substantially equivalent. All
Language,
the other
right?
states are greater than or equal. And so therefore, that was the feeling of we could not mandate 12 weeks because we don't have the same language that all other states have. And then we got 10 weeks.
And 10 came from the unpaid, the existing.
I understand that, yeah.
You know, so the 10 weeks, what isn't completely an arbitrary number. It's linked to something else.
And if the intent was greater than or equal to, I mean, I think greater than or equal to would have been used. I think there was some, desire to have some deference. And that's why I think substantial equivalence, throughout the law was used intentionally. So we had to recognize that.
And this would prevent a 6-week at 200%.
Yes, exactly. Yeah.
Exactly.
It does provide some
Right.
guardrails that you don't have the 6-week 200% plans, which I agree would get way too far off the intent of the law. That time is also important, time and wage replacement.
And we don't really have any information about other states because they don't have just in terms of the number of weeks. Do we have?
For like an average benefit,
Yeah,
so average benefit in Connecticut is 6.8 weeks.
okay.
Is what?
6.8 weeks is the average leave time in Connecticut.
What about other states, do you know?
Well, other states, so a lot of other states actually get more weeks than us.
Right.
So Connecticut was the best analog in terms of like they're mostly a 12-week state. You can get 16 weeks in some scenarios in Connecticut. But I was looking at I think you were looking at Oregon and they were like 9 weeks, but they give up to 16 or 20, I think. Massachusetts gives up to 26 weeks, so it's not directly comparable. So Connecticut's like the most similarly structured to us, so that's why we like to use their statistics a lot. So the average length of leave in Connecticut for all claim types is 6.8 weeks. Bonding claims are longer, family claims are shorter, and medical are right in the middle.
And Oregon, you said is 9 weeks, even though.
I think it's about 9 weeks, but sure, do you know off the top of your head?
I don't off the top of my head, but you make a really good point that their available leave entitlement is much longer, so
Much longer,
it's
yeah.
apples and oranges.
But they can't adjust. A 16-week plan wouldn't be allowed to adjust the benefit down so low that you wouldn't get the maximum benefit within the first 12, right?
In other states,
No,
Here.
here. So would a substantially equivalent plan allow an employer to say, we'll give you 16 weeks, but we're only gonna pay you 3/4 of the benefit? So that, my exposure is less if you only take 8 or 10 or 12. Right? You would have to take the 16 in order to get your maximum benefit.
that's what you're saying, yeah.
Good question.
That is a good question. Joan?
So I'm a little worried about comparing other states because I think the benefit structure is also so much different. So you really have to keep in mind the breadth of benefits here versus the breadth of benefits elsewhere.
Yeah, but the struggle is real for employers because they have employees in various states and they have existing like parental leave plans that they've got to consolidate this into, so challenging.
Without a doubt, consistency, but the laws aren't consistent. Yeah, so it's just an apples to apples comparison that I'm concerned with.
Is it possible for you to summarize, so in order to be a substantially equivalent plan, employees can't be required to pay in more than what they would be under the public option.
Correct.
As I understand the revised proposed rules, they would have to include all of the definition of family.
Yep. That was the
That the
change.
rules would
Yeah.
provide. They could go as low as 10 weeks as long as they increase the pay to make up for the 2 weeks lost.
Yep.
Can you highlight some of the other differences? I mean, it seems like the 10 weeks is what stood out to me as the primary thing that could be
Yeah,
different.
changes wise, I think those are the changes. All family types have to be covered.
Yeah.
And a 10-week plan can be used as long as the total payment is equal to or greater than. So those are the changes. The previous version of the rule talked about how you can use a different definition of benefit here, how you can structure intermittent leave differently, how you can do your wage tiers differently. But in terms of the changes, those were the two for substantial equivalence. Although we did also clarify that a leave plan but an accrual plan, PTO plan is not sufficient. Because we heard a lot of comments about that, we offer, 50 days of sick time, but it might take you years to get there. So it has to be a benefit coverage from day one of employment in theory. So a PTO plan that relies on accrual is not substantially equivalent because they're not coverage. It's not a benefit coverage day one.
Yeah.
So we added that as just an example of something that's not substantially equivalent. That was another change.
Look, you made a comment about Connecticut, 6.8 weeks. Does that mean that the employee got paid 6.8 weeks? So they just didn't use the whole benefit?
Correct.
Okay. I wasn't sure of what.
Yeah, because people say like 12 weeks, it's up to 12 weeks.
Okay.
So in other states, like people aren't always taking that benefit. And when you look at Connecticut, the average leave time, and they're mostly a 12-week state, is 6.8 weeks. And bonding claims tend to be longer, bonding with a new child.
Yep.
Family claims tend to be shorter, taking care of a family member tend to be shorter. Medical claims are right about average when you look at other states.
Connecticut also has the highest denial rate too, right? Which
Well,
will contribute to drive down.
It did, apples to apples and oranges,
Mhm.
So Connecticut defines, they had that one article that came out soon after their plan started, and it talked about a high denial rate. But they define denials differently than other states do. They consider incomplete applications as a denial, where other states look at that and code it separately as an abandoned application or an incomplete application. So I'm not sure that one article that Connecticut had at the very start of their program was really a fair kind of assessment of their program, because they were defining denial differently than a lot of other states. And some of it was kind of, politically motivated because they do have a private administrator. So I think there was a lot of attention on what is the approval rate going to be of that administrator. And there was that one article that came out that people reference a lot.
And I'm not sure that those claims would have been included in the 6.8 week calculation in terms of.
How they counted that.
Yeah.
Granny Smith, Pink Lady. Connecticut, do they do employer contributions, just employee?
I think it's employee only in
Yeah.
Connecticut.
So,
Yeah.
That's a big difference.
Yeah.
Other questions or comments on that part of the rules? So I guess I'll just ask, so it sounds like, well, this group had proposed allowing for an earlier application for substitution of the private plan, as long as the program went live. And that your legal analysis determined that even though it's not a requirement, nobody's required to do the private plan, they're not required to do the private plan immediately, but despite that, you don't think legally that it would hold up to require people to apply early for the private plan to get out of making a public contribution, go live with the.
So I think it was that, I think there are a number of reasons. So it was the risk of a legal challenge was one of them. I think at this point, the law is new. I think it's difficult to anticipate what the results of legal challenge would be. So there's that coupled with other.
Yeah, that, and then I think just feedback from the business community that they didn't want to be pushed too quickly into a plan. Where other states were allowing an opt-out early, but weren't requiring benefits early. And we still, did not allow the declaration of intents, so we tried to thread the needle of, what we think is important for a strong trust fund. And, listening to the business community as well, the expectation having been, from several recent states about a declaration of intent, which we're still not doing, and everybody being on the hook for at least one quarter. We were trying to, balance plus the legal concerns was ultimately what we wanted. So
It just strikes me that the department will be flooded, flooded with the applications in April and May,
Yeah.
right?
well, we would expect it.
Because they
Regardless.
they don't want to pay the tax, right?
Yeah.
And so, but if they're not approved, I don't know.
Yeah. We were expecting a flood in April or whenever we opened up the private plans. I mean, there was always going to be a large push of people that want to opt out. I think it's going to be less than if had we done a declaration of intent for sure. Because at least now people are looking at actual plans, looking at actual pricing of plans. and entering into a contract of a plan. So I think it's gonna be less of a flood than it would have been for a declaration of intent, so.
Is there any consideration for the application period? Applications being allowed sooner than that date, but approvals not being allowed till after that date?
That was where I was thinking too.
Say that again.
Is there any consideration for allowing applications prior to April 1st, but having the wording in the rules saying
Oh, I see what you're
they can't be approved prior to April 1st?
No, we're trying to give some time for the market, the private market to establish, like VOI is already on top of it, they'll have their checklist ready. But allowing the private market to establish too, so that, you know, it's not first to market necessarily, and ensure that gets the first certification and then go on selling. We want to give it a little bit of time to establish, make sure our system is up and running. You know, we have no doubt it'll be early 2025, the worst case scenario. We don't want to have these things rolling in paper. We want them tracked in an online system, making sure we have the staffing ready to address the flooding of all these applications. So to make it as orderly as possible, you know, April, I think, was what we were comfortable with.
And what's the fee structure, sorry, for iterative application process, right? It's $250 to apply.
Yep.
You get it back if it's approved, you don't if it's denied. What if
Wait, you don't get it back.
you don't get it back?
Yeah. And as for the administrative reimbursement, because in the statute, there is the clause, I don't have it right in front of me, but recouping the, oh, there it is, H7, cost of administration. So making sure that we're recouping the cost of private plan oversight. So we did look at other states, you know, what they charge for application fees and oversight fees in states that allow cost of administration reimbursement. And it does, you know, vary from 100 to 500, anywhere from 1 year to 8 year exemption. California actually charges 14% of total premiums to have a private plan. So even if you have a private plan substitution in California, you pay 14% of what you would have in premiums for the administrative costs of, there is still staff time of our program designated to reviewing these applications, but also auditing these plans, customer service related to getting applications set up, system design costs, appeals. You know, there's a lot of administrative costs for private plans. They're not cost neutral. They actually cost us a good amount of money. And feedback we had from other states is even their fee structure isn't covering the full administrative cost of oversight of private plans.
So the fees defined here, 1382, then are $250 with the application, and then another $250 a month.
Right, for the oversight, the
Okay,
appeals.
I
and
was
the,
reading that as an administrative reimbursement. Back. Gotcha.
Has the department considered, and I'm just concerned about employers being upset if they end up having to pay for the second quarter because they're not approved on time. Has the department considered perhaps opening up applications that period, but setting expectations that everybody will have to pay for the first and second quarter, and approvals will only begin in the third quarter? I just worry that, you know, there'll be employers who will be paying that second quarter because there'll be too much flooding and the department won't be able to handle it. And
certainly
they'll be
consider
upset.
Yeah.
No.
I was gonna say, I would imagine the possibility of not paying
Absolutely
the
not. What's
second
that?
quarter. I was gonna reinforce what you're thinking, David. It's like, I think the potential that you wouldn't pay the second quarter would outweigh the finality of only allowing quarter three forward. You know what I mean? Even if there's a chance that employers can get out second quarter.
You'll have a few unhappy people potentially as opposed to a whole group of them.
Right. Yeah, I think if we said quarter three for everything, we tried to move the application up as much as we could and still have comfort that this was going to be an orderly process, recognizing this is going to be a lot of work for us next spring.
I think that what you said is great. If you get your application in by the end of, what did you say? End of May? Or no, 1st of May, right? Wait a minute, April, May, June.
End of May,
Okay,
end of
so
May.
end of May, if you get your application in by the end of May and you're approved.
In that quarter, I think
And
that's
you're
the real
approved
point.
in that
Yeah.
quarter, that's the thing, David.
Right.
Right, but if if they're flooded and they can't get to you and you're one of
Okay, so
a
then,
handful of people who has to pay the
I
second.
mean, you should have done it earlier. I mean, right? I
I
mean,
mean, you could take that approach and just say too bad, for those folks, but
That's
but if you get it in, June, then no, you're not gonna get it approved in time.
well, you won't get it approved in time if you get it in June, but even if you get it in April or May, there's a risk that if there's too much
So
flooding.
then you get your money back.
You don't get your
You
money.
don't get your
back.
money back.
I'm saying you get your money back.
Oh, you're
Right, I'm saying if you're gonna make a commitment that you're only gonna pay Q1, then you're only gonna pay Q1.
Well, see, this is my concern.
it seems like you should be able
Setting
to
of expectations.
approve them pretty quickly. I mean, you've got the people who are self-insured, which are gonna be harder for you.
Yeah.
But the people who are private pay, you've already approved Unum's plan. You've already approved whoever's plan.
Yeah.
It shouldn't be that hard to approve my application to Unum.
Yeah, we would expect that the fully insured plans, if they're uploaded correctly, are gonna take less than a minute per plan.
Less than
problem-
a minute?
Less than a minute
Per employee.
per employer, but I think the concern is there's gonna be 1,000 to 2,000 of these at least.
Right.
And then you're gonna have the ones that aren't
Technology
properly.
errors, I mean, there's.
Yes, not the
just-
ones that aren't properly uploaded, the ones that are just, uploaded of something completely random, not an insurance plan. And then the fully insured plans are gonna be time intensive, like those are gonna take actual staff review one by one, so.
Will the private plans that are with Unum and others, will those be available for employers to shop on the BOI website for those, or?
I don't know how the private plan.
Yeah, probably not.
Okay.
And we don't, we're not a marketing
Yes.
tool, but, those plans will be marketing themselves. I mean, they have every incentive to have folks out there know that they're available to be
I'm
purchased.
surprised I haven't heard about it already.
I was gonna say, I'm sure
It's
they're
out
working
there.
on it, yeah.
I don't know if that gets the resolution to your question or to the conundrum that the department.
Well, that's the situation we're in. I mean, if people have different ideas, we're here, but this is,
I'd say back the date up to mid-April versus saying everybody's gotta pay Q2.
That would be back the date up to.
Yeah, you have to have your application in by,
Oh, but the deadline to get your application in order to get approval in Q1,
yes.
your application has to be in by,
Because you have, everybody's paying for it.
sorry, what Q2?
That's kind of just committed to a turnaround time.
Mhm.
Right.
Yeah.
The avoidance of the potential for a newspaper article, right, that they will always holding things up because they want to.
Oh, right, oh, that'd be great.
Yeah, just wait.
Here's how he gets an extra quarter.
Yeah.
Money in it. Doesn't cost us anything.
Fiduciary responsibility.
I just want to clarify one thing also. We're creating the checklist, but the Department of Labor is actually approving the plans.
But you're working collaboratively.
Yeah.
We're working collaboratively, but I mean, we're not going to be the ones who say these are the, approved plans.
Is the checklist done?
Not until the rules are finalized, but it is nearly done, just with, some potential changes based on the new set of rules.
And so we would be able to see that somehow, somewhere?
I don't know how that would, so
That's a question for BOI, but I think once rules are finalized, BOI would have filing guidance, is that,
I would need to find out.
okay, yeah.
So and as with the last meeting when we discussed the rules, we do have, I presume, you'll correct me if I'm wrong, the ability to provide and vote on providing a public comment as a group, majority vote, or certainly on your own within the timelines of the public comment.
Yeah, same process as last
Same
time.
process. So further discussion about the substitution of private plans.
You kind of alluded to the fee structure might change, might be more than the 250 and 250. I'm assuming before private or self-insured plans apply, we'll know what that fee structure is
Oh, that-
100%.
That's proposed now.
Right.
It says through redetermination in future years.
Right,
So cost of inflation,
Right.
10 years from now, we won't be charging 250, I assume.
Right.
But that is a proposal right now. That won't change if these are finalized.
Yeah, it
250.
says it may be increased on January 1st, 2026 or thereafter. So the fee structure would not go up before January 1st of 2026.
So if these rules are finalized, it would be that
Right.
cost structure.
I'm
For
just thinking
25.
if more go that way, more than the 2% as you've seen in the other states, and that administration is gonna be a lot more expensive for the state, and therefore the fees will be going up,
We're gonna start tracking hours we
right?
devote to this, yeah.
Because if you go to the state program, it's free, right? It's built into the cost of the program.
It's the premium.
Right.
Yeah, it's built
Yeah,
into
so
the cost of
built
the program, I think is a
Yeah.
reasonable way to say it.
Okay.
Mhm.
Further discussion about substitution private plans? Any proposed public comment from this?
Only, and maybe this is a different subject, would be undue hardship.
Different subject, and we can turn to the, if there's no, I just thought to check and see if anybody had a.
Well, because undue hardship, as it relates to a private plan, would operate differently in a private plan versus the public plan, correct?
So if a private plan had an undue hardship process, it would need to operate similar. I don't think a private plan would be required to have an undue hardship provision to be more favorable to the workers. So I don't see why that would need to be required.
But
And I don't think most insurance companies would have an undue hardship
That's my guess too.
because it's unique to Maine's PFML law. So if it does not, so if using Unum as an example, if Unum has an insurance policy that does not have undue hardship, the lack of undue hardship would be fine.
Substantial equivalent.
It would
doesn't
be
apply to both
substantial.
the employer and employee side of the house. I'm not trying to envision a scenario where an employer would complain and say, well,
Well, the
why is this plan
employers,
allowed?
but the employer's buying that plan.
And they're
The
in
employer's
contract.
buying that plan, so you do look at it of the employer's making the marketing choice to buy that plan. If the employer wants the undue hardship, it's not state law, they can stay with the state law. The employee doesn't have any choice in the matter. Unlike in Connecticut,
unlike, I'm sorry, I missed that,
unlike in Connecticut, I believe,
They have to vote.
They
If
have
you're
to
gonna
vote.
go a private plan in Connecticut, at least 50% of your workforce at your company has to be in favor of going to a private plan.
California as well.
California as well. So their opt-out rate is less than 1%, you can imagine.
So before, let's take the self-insured. You could, an insurance company also could have an undue hardship provision.
Yeah, they could. It would have to operate similar to ours,
You
yeah.
have to operate similar.
Yeah.
Right.
and that's the question, they
Yeah.
don't have to. Right, if you have an undue hardship with a state plan, you go to a state organization to say, you can't claim it, right? At me as an employer,
If you have the state plan or the private
if I
plan.
have the state plan.
Yeah.
no, you
And I,
can't, it's, undue hardship is about scheduling. It's not about making a claim.
understood, say, look, I can't be without you in my operation for 12 weeks, so therefore we have to come up with a different plan, right? We have to come up with a different way of doing it.
It has to be scheduled.
But
Well,
it's
there's the
just
whole process,
scheduling.
yeah.
You can't say you can't take 12 weeks.
I can't take 12 weeks for this person all through the
But it
summer.
has to be, but it has to be based upon the medical need, what the doctor says, and all that. So I mean, it's about scheduling. I mean, how it's envisioned that it would come up most commonly is with intermittent leave and schedule, things that things, medical things that are subject to the employee being flexible with the scheduling.
Accommodation.
Non-emergency surgery.
Right.
So whether it's a private plan or not.
I didn't.
Because it all appeals would have to flow through the department, regardless of whether it's a private plan or not.
For undue hardship,
For
for any,
any,
yes.
Well, it's appealable and appeals would come.
right, so if there was a disagreement between the employer and the employee about the hardship determination under a private plan, it would come.
Who decides on a denial in a private plan? Because the state only looks at the appeal. You know, say I have a private plan and the administrator of that private plan is also me. And a lot of denials coming through. The appeal would only go to you guys. Where's that oversight to make sure an employer isn't
Denying too much.
denying too much?
That would be the operation of substantial equivalence. If your denial rate is twice the state plan,
Right.
you're probably gonna get a revocation.
Yeah, and the section about audit and revocation and the way you're actually running your plan.
Right.
Yeah, I mean, if there's gross discrepancies in your statistics, and we do require statistics of private plans, and that's why we ask for it. If there's gross discrepancies in statistics versus the state plan, you're probably gonna get revocated. And then you're in the state plan for 3 years at least.
I know a lot of the business community, our major concern was fraud by the employee, but this is the case where there might be fraud by the employer.
Right.
Mm-hmm.
And that's why we had the auditing, you know.
Right. I just don't know what that portal looks like. You'd see every claim come through.
You're talking about appeal.
Prior to appeal, 'cause I know appeal,
Well,
the Department of Labor sees, but prior to appeal, it's.
we're not gonna see,
Right,
yeah, that's gonna be managed by either an insurance company for fully insured,
right,
Or
but say it's
employer.
not you, but say it's, you know,
an employer.
right,
Self-funded.
right.
Yeah, we won't see it until an appeal or through audit, if we're doing random audits or complaints.
So here are complaints.
So if the employer has insurance and the insurance plan does not have any undue hardship limitations on accessing the benefits.
Yeah.
Can the employer have a policy that tracks undue hardship in the rules to gauge the timing of when the leave comes? So in other words, can there be those dual things where if you buy the product and they don't have undue hardship, then you just follow the plan, and if it's approved for the time period that the employee has requested, the employer just does not get to avail themselves of the.
Yeah.
That's the latter, okay.
The latter, yeah. If they're buying a plan that does not have an undue hardship provision, they're under the rules of that, and it was an approved substitution with us, they're under the rules of that plan.
Okay.
So they don't have access to the state process of undue hardship at that point, yeah.
I had a related question about this that I'll just bring up now about the hardship provision. I noticed there was a disconnect in the use of when it has to go to a medical provider on page 8 versus page 11. Because the introduction of the medical provider approval appeared to be new to me, along with the missing affinity definition. So I'd like to talk about those two things.
What was the question?
The question was, medical provider, having to have your leave approved by a medical provider. That was in blue in the new version.
Yeah,
So there was a mention on page 8 and then another mention on page 11, where on page 11, under hardship rules, the decision belonged to the administrator, not to the medical provider. So it appeared to be a disconnect to me. Plus the medical provider stuff's new, and I have concerns about that anyway, because that generally slows claims down quite a bit. So I'd like to know if maybe it's possible to have an employee waive that, if possible.
so this is for
I don't know where it came from.
page 11, section H. Is if you have an undue hardship, where the employer, we're saying that the employer's undue hardship defense or assertion is reasonable. So they say with their employee, okay, you can't take your 6 weeks of leave now. I need you to wait a month and then take your 6 weeks of leave. If it's a medical claim, so the employee has a medical condition.
Right.
And the employer is saying that we need you to wait 30 days to take this leave, and it's a medical claim, we're saying that needs to be approved by the provider. In in that scenario to make sure there's not a medical need there. Is this something that could be delayed? Is this like an elective surgery, for instance, that could be delayed 30 days versus if this isn't something the person treats in that moment, could have detriment to their health. If that's the case, then undue hardship's gone because there's now a case of illness or immediate need. If it's something that can be delayed, then sure, undue hardship prevails. So that's what that added step was, that if there's undue hardship claim that it's found reasonable, the employer's assertion is reasonable as we determined through this process, and it's a medical claim for the employees, not a family claim. Their health provider has to say, okay, there's no medical risk here to delay.
So in the case where, maybe this can be covered in an FAQ later, but in the case where an employer has, two partners, baby, they've had a baby, one, the birthing parent has a medical claim, the non-birthing parent has a bonding claim. I'm assuming you're going to put the medical claim first. So when an employer decides, I can't lose you both at the same time, how would that be handled? I guess is what I'd want to see some direction on.
Yeah, I think we'd have to clarify that through FAQ. It's very specific, yeah. But I mean, for one of those people, it's gonna be a medical claim, for the other, it's gonna be a family claim.
Right, but they're both absent from work at the same time with the same employer. And is that an undue hardship, that kind of thing? And what control could they have over it? So again, I know it's in the weeds, I'm just saying it's coming.
Yep.
Thank you.
So as a physician, I would be loath to be the agent of the employer. So if the employee is my patient, I would have a hard time saying that medical leave is not indicated for a medical condition at that time. I think it's a process, but I don't think it's a process that's going to yield much joy for employers.
Well, I mean, that was my question, that, sort of malpractice, like how often can doctors actually say on paper, no, it's not necessary, they can actually wait. I have a little concern
Okay,
about
so
that.
the way the rule's worded, it's worded if an employer's proposed schedule.
Mhm.
So how this is coming up with undue hardship.
Right.
Employee has applied,
Right.
employee has put forward a schedule. Employer says, no, I'm an undue hardship, do this different schedule. That different schedule, the employer's proposed schedule, which is different than the employee's, is then subject to review of the employee's physician or other healthcare provider.
Correct.
So it's then that the employee has an opportunity, that it's not just the employee, it's not simply the employee saying, no, I don't want to do that. My doctor says, it's the doctor says.
But I'm just concerned the doctor will never say that it could be.
Right.
On paper, how risky is that for a doctor to say, no, it can wait,
It's elective, I mean.
Well, if they can't wait, they can't wait. That's kind of the.
Right, but
So,
I'm saying,
I mean,
is it
but-
never? But you
Right.
agree with me as a physician, he's
But-
saying, it will pretty much never say that it can wait.
But the point of leave is that someone who needs the leave can take the
No, I
leave.
understand, but. I think
Because we actually had some comments, can you exempt out medical claims completely from undue hardship? And that's not how the statute.
No, of course not, no, I understand if you have,
So, I mean, this is, again, we are the only state
Say
with
that
undue
has
hardship.
undue hardship, so we're struggling with.
We are inventing a process from the ground up, recognizing that, medical claims, you don't want anyone to have harm.
no, certainly not.
And that's
but I'm
always
just
gonna outweigh
curious.
business interests if somebody needs leave.
Yeah.
So especially with medical claims, undue hardship is gonna have a lot more scrutiny. And if it can't wait, it can't wait. That's-
No, of
that's
course,
important.
I mean, I get that, I'm just curious if it ever, right, I mean, I guess we'll have to see.
And it's different from a
Fairly.
disability claim where the disability determiner is an employee of the state or the insurance company or whatever.
Right.
I'm still an agent of the employee.
But this exists today under FML. I mean, we're just talking about adding pay to it. The family medical leave already has contingent plans for reasonableness for employers. So I'm assuming you're not doing it on that, or you're breaking new ground, and they'll help us.
I guess the hope would be that employers and employees largely would be able to work it out.
Right.
The
Well,
employer
exactly,
says,
Yeah,
this schedule doesn't really work for me, but can we do it this way? And that's okay with the doctor, then they can.
Because the other thing we need to add in response to comments from both sides, you know, quote unquote, is the waiver of agreement at the front. You know, if both parties say this is an agreeable schedule,
Right.
then you don't have to do the 10-day employer review.
Yeah. I think that's
And I think that was something that was asked for on both sides. You know, the employee advocates were certainly asking for, is there a way to expedite undue hardship? And some certain employers were saying, like, if we aren't asserting undue hardship, is there a way to expedite it? So we added a piece that if both parties agree, this schedule works for both parties, and the employer waives undue hardship, there is no 10-day review anymore.
Yeah.
Yes.
Right.
So the hope is that, you know, people are, you know, giving proper notice, having these conversations well in advance. If it's a case of emergency or in a car accident, undue hardship doesn't apply anyways. So we're hoping that these are, you know, a few cases, and there'll probably be some messy appeals to start, but I think people will start learning the ropes that, you know, what the rules are, and hopefully it's not a large number of claims.
Is medical provider very specific at its definition?
Yeah, because we cite to the FMLA, federal law,
Yeah, the federal law.
and then there's like
Definition.
12 license types that it actually lists out or something like that. So it is very specific.
Okay.
I couldn't tell you what it is off the top of my head, but
I'm sorry, I have another question about undue hardship, and again, I have to look at this really quickly over the weekend, so just let me know if I'm totally off base here, but, so the employer may reasonably determine that scheduling of leave creates an undue hardship. An employer may not claim an undue hardship with respect to scheduling of foreseeable leave if sufficient notice has been provided. Well, unless this employee establishes that in the specific context of the employer's business, the amount of notice provided was insufficient. My concern here is that it's not just about the notice, right? Because this makes it sound like as long as they give notice, you can't do undue hardship. Am I reading that wrong?
no, but because the statute also talks about undue hardship in the context of scheduling of leave. It's not the taking of the claim, it's the scheduling of the leave cannot create undue hardship. And so if you want to jump in on that one.
Because it's not just about the notice.
Yeah.
Like, they might give me sufficient notice, but does that mean that I can't, as long as they give notice, I can't say.
As long as they get proper notice.
So I think it's not just about the
Yeah,
notice time, it's about the time of year or two people taking it. Or three
Yeah,
people.
no, sitting here right now, I understand the sentence you're saying, it's
Okay.
something we'll look at.
Okay, great, thank you, appreciate that.
Go ahead.
No, it's a different subject.
Oh, I was just gonna ask for clarification, because I guess the way that I read the rules is that if the employee does give at least 30 days notice, there can be no undue hardship
Right,
claim.
that's in problem.
May not claim undue hardship.
Well, there's a higher standard. The employer can still make a case.
Because that's
It's
not
just a
how I'm reading it
presumption.
here.
But the
It sounds like it
presumption in
can't be
favor of the employee, if they,
Right,
but
exactly.
it could be
Yeah.
overcome by the type of, the nature of the business.
But to Nancy's point, we can definitely.
Okay,
Yeah, clarity of
The
that. Yeah.
rest of that sentence says, unless the employer establishes in the specific context of the employer's business, the amount of notice was insufficient.
Right.
Right, so
Right.
seasonal employee saying, I'm gonna have elective surgery and I gave you 30 days notice, but it's gonna take me out for 12 weeks of my
right,
4-month season.
right. Well, maybe just,
So I think the thinking was that last clause.
okay, that supersedes
So
that.
yes, is a exception to that. right?
Okay, as long as we feel comfortable. Joan?
Yes, I just wanted to note that the checklist will be online. Checklists are currently online for other types of insurance. I can send a link to, if that's helpful, if you just see what, that can help you go to sleep at night.
But not until rules are finalized.
Yeah, no. I mean the link to the other.
Oh, gotcha, yeah.
If you want to see that. These aren't finalized, but the other thing to think about is that the checklist will pretty much track the statute of the rules. So.
Further discussion on undue hardship. Are there other aspects of the rules that anyone wants to talk about?
Just have one quick question about the I was happy to see you address the zero paycheck
Yeah.
situation. Thank you. My question, so I know it's such a minuscule part, but my one question is, so if, so I can collect it later, that's fine. Whose responsibility does it fall? Let's say they have a zero paycheck, 2 in a row, but they give notice and they leave, right? So I've never collected that. Is it my responsibility? Is it like, because there's no more money to collect it from? So they leave owing the state their.
Yeah, we'll do that in FAQs, in
Okay.
consultation with, the wage and hour people.
Okay.
Also.
Okay,
So the expectation then is the employer is not gonna keep the state whole and be responsible for recovering from the employee if the premium, if they're 50% withholding, for example. Or is it possible that it could be applied as the
I think-
employer is responsible to pay?
So I
Maybe
think
change
the
themselves.
zero paycheck was more so with, the tipped wages.
correct,
Where people make half of minimum wage.
correct.
And then we get tips in cash.
So like,
So that's
yeah,
not
so if they stay
withheld
with me,
and
yeah,
all
so
the
their next check, I can take
Right.
it, but what if there's no
Right,
next
and I
check?
understand what you're saying, but yeah, we'll have to address that in FAQs.
Thank you.
I have a related question as well. Normally when an employee goes on any sort of unpaid leave, even though this is paid, it's not paid on the employer payroll, we're given the opportunity to either accelerate contributions or take them when they come back for their benefits, or home bill if the employee agrees to that. Could we home bill for the premium?
So,
Meaning, so if someone's on a leave of absence and they want to continue all their benefits, we normally would have the option to home bill the employee while they're out. Could we home bill them for the premium they're missing paying as well for?
Well, they're
they
getting, the premium is on wages. If they're not earning wages, there would be no premium. So it's not
Okay.
like it's a flat amount where you would bill them for their health insurance.
Okay. Okay, so what we're saying is when someone is on paid family leave, they just don't pay premiums at all. They just don't,
That actually-
anybody who's on leave doesn't pay premiums for paid family leave.
That actually speaks to the taxability of benefits, which we do not know yet, because the IRS is not giving guidance yet.
Okay.
They said they're gonna be giving guidance, this year?
They said the end of the summer, which is already here, or the end of the year.
Yeah.
So,
So we don't know if PFML benefits, our PFML benefits are taxable or not, which would make them, premiumable or not, until we have IRS guidance.
and then the administrator would be doing that. The administrator could withhold
Yeah.
from the employee.
But we don't have the IRS
Yeah,
guidance yet.
Forget that.
Nancy, what did you say? I'm sorry, I didn't hear you.
Sorry.
If it turns out that they're taxable wages, if that's what the IRS says, one alternative is for the employee half that the administrator who's paying the premium,
Third
right?
party administrator paying the
Who's
benefit
paying
checks.
the benefit checks to the employee would do that.
Yeah, because they give or we would give a withholding form even now. Do you choose to withhold 5 or 10% for state taxes, for
Yeah.
instance? So I think we could withhold potentially,
I think we have to, I think we need to think that one through because they're not wages. The PFML benefits are not wages, even if they are taxable.
Yeah, they're not.
Unemployment benefits are taxable, but they're not wages.
oh, I see, okay.
Right.
So we'd have to clarify.
Oh, right, okay, so you're saying it doesn't, right.
But when you looked at the funding for all this, you assumed that the number of families would be paying any premiums.
I don't think they went that far into it.
Okay, so we're looking at maybe a deficit if nobody's paying any premiums the whole time they're out?
I don't think they made that assumption that they're paying premiums during leave.
Okay,
And the employer wouldn't owe premiums either on those, because
It
They're
comes
not
down to that
wages.
question of, is it
Is
wages
it
or not?
wages?
So I think
Yeah.
that's something we have to clarify.
Yeah, and we'll put that in FAQ. I think.
FAQ, yeah. Yeah, Google that before benefits started, obviously, so we can clarify that.
Totally on a different subject. What about employees that are needing to avail themselves of this program but don't have a bank account?
Also, we do have benefit card as an option.
Okay,
Yeah.
I see that, I just,
And that was put in for specifically that scenario. A lot of people won't have access to bank accounts. Yeah, beyond bank.
okay.
So those are like debit cards?
Yeah.
Okay.
Yeah.
It's just that's still
Until
limited,
next year.
that's still limiting to many people.
No, it is.
It
And that's
is.
when we didn't put in, I think, right rules about the benefit card.
Right, but the benefit card is still limiting, so
It's already.
it's still limiting for
Yeah,
access.
yeah.
So, okay, thank you. Other questions, comments about the proposed rules?
I recognize that, I mean, we just got the proposed rules last week and this meeting came up quickly. We need to set dates for our next meetings. We could decide to set a date prior to the end of the public comment period if people want more time to look at the rules, speak with their constituents, maybe even attend the public comment session on the 17th. That's certainly an option that we have, but we also need to schedule at least one meeting in the final quarter, right, in the fourth quarter.
October to December, yeah.
Right.
Yeah, can I ask a question? Sorry, I was still looking at my notes when you said that. I'm still unclear on what happened to the affinity definition. I know in this new write-up, it throws to the different sections that like the state family medical leave for the definition of family member, which is not the same as what we talked about before. It's fine. I just want to make sure everybody's clear on it. Because it's got like domestic partner and it's got a whole bunch of other stuff, but I don't know if everybody is clear on what it is.
So we took out the term affinity relationship because affinity relationship was never in statute to begin with. And that was, I think, causing confusion, but also Doug's point last time is that affinity relationship was never a separate category from family. It was always a subset of family. And so like that's what we went back to, is we just used the statutory, we referenced statutory definition of family, which included as a subset in it, a person through which you have a significant personal bond, quote unquote. And then we did try to use it, I think we used the same authority language that was recommended through motion as just how a significant personal bond could be demonstrated. We used that same definition. We took out the reference to cousin though, because we didn't want people seeing cousin and presuming that every cousin would be a personal bond. But I think that's the only change that we made to the recommended language. We just put it in a different section of rules to kind of eliminate that confusion that we created the first time that affinity relationship was something different than family member. It was never anything different than family member. And with that, we took out the cap because there was no limiting one person per year for any other type of family member. So a person through which you have a personal bond, a strong personal bond, is a subset of family member. It's treated as such.
And if it's unclear, then it's decided by the administrator.
It's attested to by the claimant.
Okay.
Yeah.
If they attest to it and then the administrator, so it's a pass through. Nobody challenges it, right? I'm not looking to challenge, I'm just wondering.
I mean, they have to attest and provide information that, along those kind of guidelines of why it's a significant personal bond. And we give some examples of things they can provide, and then they attest to that relationship.
So an employee could have like, I don't know, 7 leaves a year, right? As long as it doesn't go past 12 weeks.
That could be true in any scenario,
Yeah.
yeah.
Okay. Thank you.
Is there any other? No. Okay. All right. So how many of you would like to set a meeting in September prior to the end of the public comment period?
Well, yeah, let's talk about what will happen at the end of the public comment period. I mean, nothing is gonna be processed by then, right?
Right. Yeah, exactly. If we want to submit public comment as a group, and we want more time to consider what that might be.
And would we have information that comes out of the public hearing on the 17th? Would you pass that to us?
Well, it's gonna be recorded.
We would have the ability to review that, and if we set a meeting between the 17th and the 30th, we would then be able to
Comments
discuss.
close the 30th.
Yeah.
It closes on the 30th, right, exactly.
It closes on the 30th, so after the 30th, even as a group, we could,
Correct.
we have to. We have to, that's the way I look at
To
it.
meet, we have to meet, is that what you're saying?
Yes,
You
we
can
have
comment
to.
individually.
What's that?
You can comment individually as well. In a perfect world. In a perfect world.
You could comment individually, yes,
I think,
and achieve the same things.
well, you're not gonna achieve the same as the authority saying,
That is exactly what I just said, yes.
excellent,
That
thank
clarifies
you.
it.
The question is, did everyone have enough time to look it over and feel that they're, you know, 'cause if we wait and have a meeting, but we have nothing else to add.
Right, right. I think the question is, if you've already had time to review and digest the proposed rules, talk with your constituents, feel like you have enough, information to have provided the voice, then there's no need to meet. But if you would like to see what happens or have more time to digest everything and come back and have that opportunity, then we should set a meeting before the 30th.
I would propose a meeting on the 24th, which is the Tuesday between. Because I think the rules came out Wednesday, it's a holiday weekend.
Yeah.
And I did read them, but that doesn't mean I've heard from anyone or talked to anyone or, as representatives of our constituencies, that has not happened. And I think we need to give that opportunity for our constituents to reach out to us.
Okay, how many of you agree with, meeting again before the third, between the 17th and the 30th? Yes.
Hey guys, it's Chris. I would agree with that.
Could I add to that if the Department of Labor could come up with some sort of cliff notes of the comments they had received up until that point?
We can't do that
You can't do
under
that.
Administrative Procedures Act, because some
Okay.
people are getting comments on comments.
Right,
The agencies never do that.
okay.
Does the 24th work for everyone? No, not for
So
that.
DOL
No.
stateside, we actually have several big meetings related to the FAST Enterprises project. Nancy's on vacation that whole
No,
week.
I'm at a conference.
You're at
I'm
a conference
work
that whole week.
conference.
Actually,
So
you are as
that's
well.
the week, yeah.
So
The whole week.
the whole week of the 23rd?
The whole week of the 23rd.
So we're actually looking at the 30th. That's too down to the wire, or we could do someday after the public hearing. If you all want to hear the input of the public hearing.
I think we need to hear the input from the public.
What's the comment
Technically,
deadline?
How about the
30th.
19th? Does the 19th work for?
Can you just ask, the 30th, because it's the authority, right? We're not taking time to draft these formal comments after that date, right? You draft them as part of the meeting, so the 30th actually would not be problematic if it fits people's schedules.
Doesn't fit mine, but Sam?
I just won't go to work before the meeting and get caught, so.
I have no issue with the 19th, honestly, either. There you go.
I can make the 19th at 10 o'clock, but I couldn't make it at 9 o'clock.
How many of you can do the 19th at 10 o'clock?
So, but
Yeah.
let's think about this just for a second. So the meeting, public hearing is on the 17th.
Yeah.
It's gonna be 2 hours.
Could be 30 hours.
Could be 30.
How long was the first one? An hour?
An hour.
How many attendants?
There's 40 people in the room, but there's only like 12 spoke about, yeah.
It's at 2?
You're thinking of doing it on the same
Oh,
day?
it's at 9.
David?
No, I'm just saying, so that we have a gap of a day
Oh, right.
to digest what was in that meeting and then
Right.
come up the next day. So,
Yeah.
does afternoon work that day? Or, I'm okay with
The
that.
19th in the afternoon?
And I'm okay with the 19th in the morning. I mean, we just have to block the time to make sure that we can review everything. And it may not be a lot to review.
19th
just-
in the
I
morning.
will not be in this country.
Yeah,
I'm
I'm
out of town. Submit any comments to you if I can't be at the meeting?
Yes, although I think we went through this before, there can be a proxy, nobody can proxy your vote, is that correct? Is that just a comment? I certainly could, circulate comments like I did last time, where there were written comments provided, we can certainly do that. So who cannot make it on the 19th?
Hey, it's Chris. Can you guys hear me?
Chris, you can't make it on the 19th?
I'm not available on the 19th either. I apologize.
Okay, that's fine.
I can send a proxy though, but
Okay,
Oh, you can.
I can't.
Yes, you can, yes.
and who cannot make it on the 30th?
On the 30th, but isn't the 30th too late?
No, we
It's a
we
day
still
out.
have the ability to do
Yeah.
that.
Oh, so we would
Yes.
meet and then submit comments that day?
Right.
Oh, well, that's okay.
Like we did last time, we just, we articulated what the comments were and then
Okay.
they
As
magically.
long as everybody's okay. That's
Um,
actually better.
who could not do the 30th in the afternoon? There's a possibility I could back in time for that. Oh, okay. That would be cutting it very close to the line. Yes.
Yeah, I'll just clarify that the comment period ends on September 30th at 5 p.m.
Okay.
Just so, yeah, just so, you know, just so you, yeah,
Before
Yeah,
45.
right, yeah, at 4:59,
We
you
love
get
you,
5:01, yeah.
Okay.
5 p.m.
We did midnight last time, and there's
So it's more.
11:59, we were getting comments, yeah.
That's okay.
That doesn't matter, right? I mean,
As long as you make the deadline.
yeah, well, the
No, it-
deadline's been posted as 5 p.m.
Yeah,
It's
So
5
now
p.m.,
it's
yeah.
locked.
Yeah.
Right.
How about 2 o'clock on the 30th?
About 1 o'clock, or you
Yeah,
need a
2
little bit
o'clock
more
seems-
time to get to it.
I can try to, I mean, I'll try to make it work. However, and if not, Sam can. Would you prefer
You
1?
sound so confident in my ability.
I'm really confident in your ability. I would like to be here, but,
That works.
1 o'clock? 1 o'clock on the 30th, okay.
I'll send it out.
Okay, great, and then we will, and then, so like last time, and I'll put a reminder about this, if you have written comments and proposals, I think that's really helpful to have in advance, and so if you wanna send those to me and Sam and Luke, that would be great, we can circulate those in advance, or you can come just prepared to make any proposals that you wish. So then for the 4th quarter, and Luke and Reggie may have, and Nancy may have some suggestions for us, just in terms of what topics should we be prepared to talk about in the 4th quarter? What do you think makes the most sense? I don't know if, I know that we have to do at least one meeting annually where the public can make comments, but
I think you can
we
do
can
that.
push- We can do that?
You can do that the first quarter of 2025.
I was gonna say, I think you had recommended that we do that after the final rule came out, so there wasn't confusion about public comment about the rules versus just public comment to the authority.
Yes, but
But we could do it in the 4th quarter. That could be our meeting.
You could do it the 4th quarter, or you could do it the first quarter.
Okay,
And then that would start that would lay the framework for the following years.
to always do it in the 1st quarter or the 4th quarter.
Yeah, or by no later than.
Okay. What are topics that you anticipate might be important for the authority to review? How can we support whatever will be going on with the NDOL and the rollout?
well, hopefully the rules be finalized.
Yeah.
Before quarter at some point. Systems work will be right underway. Public outreach campaign will be going full strength.
Yeah.
December, yeah, early December.
Have the RFPs all gone out for the system?
System, we already signed the contract, that's enterprise this year.
But the benefits are.
The benefits haven't gone out yet, no. We anticipate this winter for that one. Actuary RFP will be next year.
December for a meeting with updates and maybe first quarter for public, meeting with public.
December for updates and then sometime in the 1st quarter for public, like maybe February for public comment.
When is it in the next year, is the actuarial?
Yeah.
Is that actuary chosen?
Did you ask when the actuary were chosen?
Or is it the RFP?
So the RFP would have to be done late 2025, right? It has to be done by February 1st of 26, is that right? I'm looking
We're
at-
talking about
The actuary.
Actuary, yeah.
That's February 26th.
So I would say spring, summer, probably, the RFP would go out for the actuary.
If we need couple quarters of wage data you can analyze.
But the RFP being released would be
Earlier than that,
probably
yes.
90 days ahead of.
Yeah, I'm gonna start working on it this January, yeah. Doug brought up a good idea that in December, we could actually demo our portal for you all too, during the meeting, yeah.
Oh, that's a good idea.
Yeah.
And do you expect that the final rules will be out by December, or I know
Hope so.
I know your deadline is
No,
January?
I feel pretty confident, yes. We have 120 days to act, but our statutory deadline is January 1st, so once the period closes, we're gonna try to act as quickly as possible.
Okay. Okay, so,
Some administrative RFP, does that go out?
We're working on it this fall, winter is when we're looking at releasing it
It'll release in the winter,
of this year, yeah. This coming winter.
so winter ends in March, or winter ends in April, or winter ends in February?
December through March, winter.
September through June.
Yeah, so that gives your insurers enough to, the people that are doing it. enough time?
Connecticut only had, I think, 6 months with their
Wow.
administrator, but they said it was terrible. We're hoping to have at least a year with our administrator before benefits go live, if not more than that.
Okay.
So if we get an administrator online, May 1st, 2025, that's a year. Again, Connecticut did it in 6 months, but they said it was too much. But we're planning for at least a year, if not more, with our administrator before we go live.
so I'm thinking maybe we could do over email, we could get the specific dates, but we'll get a date in December and then a date in February on the calendars and then see everybody on the 30th. Anything else before we adjourn? Is there a motion to adjourn?
So moved.
Michelle seconded, all in favor? Any opposed? All right, it's adjourned. Thanks, everyone. Thank you.